Hello everyone, my name is Yvonne Caballero and my community health education was health promotion and prevention for diabetes and alcohol use disorder. The two health-related problems and issues in North Hills as identified through a windshield survey was diabetes and alcohol use disorder, AUD, which is also known as alcohol use disorder, was identified through assessment of the community and interviews of the residents. Therefore, priority and focus on substance addiction and prevention and management of long-term complication, both of diabetes and alcohol use disorder, was established. Substance addiction is a chronic disease characterized by drug seeking and use that is compulsive or difficult to control despite harmful consequences, and that is according to the National Institute on Drug Abuse. Substance abuse is a growing issue in this community as identified by its residents, as I previously mentioned. Substance abuse education prevention in North Hills community, not only because of its association with homelessness, but as well as the declining welfare and overall quality of living in the community. The effects of substance abuse is cumulative, significantly contributing to costly social, physical, mental, and public health problems according to Healthy People. Long-term complications of diabetes is a costly treatment when hospitalized, and nutrition education in the community setting is one of the most effective interventions that has been applied but should be improved on in this community. Education for both substance abuse and diabetes due to its high prevalence in the community and identified as a high risk for these chronic illnesses can greatly improve the community's well-being and quality of life for its residents. The background and significance of alcohol use disorder and diabetes is that the prevalence of diabetes is lowest in rural areas in developing countries, generally immediate in developed countries, and highest in certain ethnic groups, particularly those that have developed Western lifestyle patterns, and that is according to Faruhi and Wareham. North Hills is located in the Los Angeles County, and it is a western urban area, and also has a high Hispanic population that are a highly susceptible ethnic group. The U.S. Census Bureau cites that 39,544 of 60,254 of its population are of Hispanic or Latino origin. The main etiological risk factors for diabetes are age, obesity, family history, and physical inactivity, and that is again according to a Faruhi and Wareham study. Alcohol substance use, or the medical diagnosis of alcohol use disorder, has a more complex epidemiology, mainly because many are undiagnosed and untreated. A study by Grant and others have confirmed this, and a population study nationally in the United States that takes into consideration data analysis of the same sample size shows that prevalence of AUD depends on severity. So from a 12-month and lifetime prevalence of AUD, it showed 13.9% and 29.1% respectively, and follows an inverted bell curve in terms of severity of the disorder from mild, moderate, and severe. Interestingly though, as the education level of the individuals increases, the prevalence also increases. And similar to diabetes, AUD is less prevalent in rural areas. Race and/or ethnicity does play an important role as a risk factor for AUD, and with study findings indicating an increased rates among Native Americans and lower risk for AUD among Black, Asian, or Pacific Islanders and Hispanics than white respondents. The Healthy People 2020 objectives for diabetes are to prevent complications. Therefore, the objective D-3 focuses on the reduction of diabetes death rates, and that is according to Healthy People 2020. D4 aims to lower the extremity amputation incidences related to diabetes and increased health outcomes for diabetic patients, such as improved glycemic control, which is D5 objective, lipid control, which is D6, and improved blood pressure control, which is D7 objective of the Healthy People 2020. And also increased health promotion that includes foot care, which is D9 objective, and D13, which is increase the proportion of adults with diabetes to perform self-blood glucose monitoring at least once daily, and that is according to the Healthy People 2020. For alcohol use disorder, Healthy People 2020 objective, SA20 aims to reduce the number of deaths attributed to alcohol and also improve medical treatment that are the objectives of SA8, which focuses on increases for individuals receiving treatment, and SA9 that encourages follow-up care. The needs assessment of the community was acquired through interviews of the residents of the community. A resident of North Hills named Mary C. claims that ever since she can remember, there have been multiple instances that cops would be called in on one of those questionable streets, and I'd hear my neighbors talking about a raid in one of those houses and apartment complexes. She also claims that there was one occasion that a helicopter overhead would radio in to warn the community to stay indoors because of a raid for suspected drug possession in one of the houses one street down from her. A provider at Valley Community Healthcare Clinic, Heiju Y, claims that diabetes is a major health concern for this community because of the big Hispanic population and their predisposition to the disease secondary to their diet. The community needs was obtained through a windshield survey of a lower income community within the vicinity of my living area. The windshield survey guided the educational needs of the community and the topic that the community would benefit from the most. The theoretical framework that was used was a precede-proceed model, and it guided the teaching in such that it assessed the community needs or the issues that are currently prevalent and requires intervention for improved health outcomes, stated the goals, it assessed the contributing factors not only for the chronic illnesses, but as well as how to intervene for the teaching plan, and lastly, the current practices that are observed may be helpful for teaching plan or as a barrier. The proceed portion of the model ensures that the plan was carried out as planned and continues to assess the effectiveness of the teaching plan, as well as introduce time-sensitive deadlines that will guide the presentation of the education. The issues and barriers included for AUD specifically is that I found that Grant and others through a study found that lack of insurance, fears of stigmatization, and beliefs that treatment is ineffective explains the lack of AUD treatment in the United States. The one advantage that AUD is that the prevalence increases with education, therefore teaching and interventions towards these population group has a projected higher retention rate. It is important to stress that relapse is a continued issue with maintaining improved health for AUD. Another important issue is that the individuals need to acknowledge that an alcohol problem is present and a change needs to be implemented for improved health. During the diabetes teaching, individuals demonstrated willingness to learn, compliance for diet modification, exercise regimen, and diabetes management are the issues that needs to be assessed constantly in order to encourage the clients to maintain or improve their health. individuals have been educated about the dangerous complications and are now seeking more teaching guidelines to manage their health. Diabetic teaching with a focus on nutrition may be introduced in the next education class, so that these population group can improve more on their management of their diabetes. Language barrier was also an issue for this population group, so the next class should also offer the education teaching in Spanish if possible. The community would greatly benefit from it. Interventions for AUD and diabetes are that both the teaching for diabetes and AUD met the Healthy People 2020 objective of reducing the number of deaths and or complications of the identified chronic illnesses, which is diabetes and AUD. Upon survey of the community, 72.3% of its population is high school graduate or higher. Therefore, determining how to execute the education for both substance abuse with a focus on alcohol and diabetic diet for prevention of long-term complications of diabetes will be the foundation of the success of the outcome objective. Education for AUD was instead provided for the individuals that are visiting the clinic at the assigned date by the program director. Effectiveness of the education was based on the previous visits at the clinic, and teaching plan was based on the previous week's clients as well. Educational techniques that was used was ensuring that the vocabulary level of the teaching was at or below 9th grade level because of the patient population of that community. It is also important to have tools of education in Spanish, considering that the population group is high-end Latino or Hispanic. But as I previously mentioned, it was not achieved because of lack of Spanish translator or just an inability to translate the presentation in Spanish. Teaching for AUD included what it is, complications, management, and community resources for health maintenance. Teaching for diabetes included also what it is, complications and management, and ways to improve their health outcomes. The budget that was necessary for the teaching for diabetes might be a little costly in the long-term goal, with a plan of approximately $100,000 per year. Research the cost of a diabetes educator, and in Los Angeles, their median salary is about $83,196 as of May 2017 from salary.com. Materials and supplies may also have to be taken into account, but some of them may be provided by companies that are trying to promote their products, so those could be free. As for alcohol use disorder, the community currently has multiple support groups that are available, so there is no financial budget that needs to be allocated towards this. Compared to starting from the ground up, you'd have to have money for possible rent or space for having that meeting. Although this alcoholism is a prevalent problem nationwide, so there are already existing nonprofit organizations such as the Alcoholics Anonymous group, which is a 12-step groups. So the project evaluation and outcome measurement for diabetes and AUD included short-term goals for diabetes were that the individuals would verbalize understanding of education, also return demonstration of measurement of their blood glucose, understanding of the dietary, exercise, and medication guidelines for management of their diabetes, and evaluation of understanding of the teaching included incorporating activities with the education teaching, such as having cutouts of pictures of food and having the participants prepare a plate. The long-term goals would be obtained because will be hard to obtain because of the lack of follow-up, but as well as the objective assessments will take time for results, such as the blood glucose measurements and the hemoglobin A1C. Those take time and the results won't come back right away. As for AUD, the short-term goals included verbalization of understanding of teaching, such as prevention and management of AUD, and this can be acquired through a short quiz at the end of the class that the patient would or the clients would write down in their paper. Short-term goals would have the client sign up for support groups and or attend a 12-step group as soon as possible. The long-term goal is to prevent relapse. Also, measurement of the success of the teaching was done, and also having the individuals write down the possible risk factors for alcoholism, the treatment plans, the prevention and management of alcoholism, and have them actually verbalize the community resources that are available. The long-term goal would be assess admission rates that the clients had related to alcohol use, or how many times they've been involved in the 12-step group, or if they've had any episode of relapse. The results and conclusion of the education is that the strength of the diabetic teaching was that it was very well accepted in the community, such that one of the clients stated that they were not aware of the dangerous complications and that diet and management of diabetes was very helpful. The class was also performed right before lunchtime, and the clients showed and demonstrated about the importance of a well-balanced diet or meal and the quality of food. One client verbalized that her daughter always tells her no on all sorts of sugar and carbohydrates, and that the diet teaching taught her to choose foods that would be compliant with her diet restrictions, and that she can have a bite or a piece of cookies, but not all of it. Moderation was the key thing that she learned from the class. The weakness may be that the class was scheduled right before lunchtime, and more time could have been allocated for the teaching to cover all topics in depth. I also felt a little bit rushed at the end of my presentation teaching because it was time to close the office so they can leave the building. For future classes, a handout as a reference would be helpful for the clients so that they can read through the teaching and possibly give it to their family members or primary caregivers who can also be educated about the diabetes. The clinic has their own diabetic teaching classes regularly and also recommends outside facility assistance, such as cooking classes for diabetics and at the nearby local hospital. For AUD education, it was challenging because I had initially planned on presenting a class for high school students, but due to being unable to acquire prior authorization to present my teaching to the school, I had to change my subject to teach it for. So the group of population wasn't high school students anymore, but rather the clients that are visiting the clinic. The teaching was provided for those who are visiting that day and inquiring about alcohol assistance. The education was received on average. The individuals present for the teaching were not very vocal about constructive criticisms or of how the class went. The individuals were also they showed interest by asking questions about resources and available services with their alcohol use. And these are the references of all of the information that I've found, and also for the images that I've used. Thank you all.